Another presentation for this week will be covering chapter 23. So welcome to another week. This week will be about musculoskeletal system, and we'll briefly talk about the joint anatomy and then delve into the physical examination and health promotion. So let's begin by reviewing the fundamental anatomy of joints. There are three classifications: synovial joints, which allow free movements, and then cartilaginous joints that offer slight movement, and then fibrous joints, which are most commonly immovable. So it's very important to understand these key aspects of the joints to perform an accurate assessment. So let's look into the synovial joints. So these are categorized based on their movement. For example, ball and socket joints offer wide ranges of motion. Hinge joints, those allow flat flexion and extension, and then condylar joints, which provide movement into intersecting planes. When taking a health history, just pay close attention to the patient's chief complaints. The most common and concerning symptoms in musculoskeletal assessment is usually back pain, joint pain, and also neck discomfort, which profoundly affect the daily living, especially of older adults. Another key aspect of musculoskeletal assessment is pain. Pain assessment, for example, using all the cards, understanding the location, evaluating the quality, the severity, use the scale 1 to 10, for example, and then determine the onset and timing of pain. This is very important. And also look at other factors that may make the pain worse. These are associated manifestations or factors. Just to look beyond the isolated pain and identify those factors. For example, check for signs of inflammation, any limited movement, joint stiffness, which may alert you for any systemic conditions that the patient might present with, for example, rheumatoid arthritis, osteoarthritis, or lupus, or any other conditions such as nerve entrapment or sciatica. So there are so many red flags that patients with low back pain may present with, not necessarily because it's one of the most common presenting symptom in primary care. They may also present with, let's say, unexplained weight loss, for example, pain at night, excruciating pain. Maybe they have a history of cancer or neurological deficits. So this may point toward underlying systemic diseases or severe spinal pathology that require specialized medical intervention and sometimes immediate or urgent referral. As we do physical examination, there's one mnemonic or one acronym that you can use. It's IPROMS: inspect the joints and posture, palpate for tenderness or swelling, evaluate the range of motion, and conduct any special maneuvers to test any specific structural integrities. So range of motion is an integral part of musculoskeletal assessment, as you are already aware. So it involves testing or assessing various joint movements, flexion, extension, abduction, and many others. You already know about them. And then what are we trying to achieve? See if there is any pain uh, during active and passive movement. And some special tests that may be done in primary care, not necessarily with the ortho. So they may include, for example, shoulder assessments, which include pain provocations. One of them is like a Hawkins test. It works by forcing the greater uh, humerus against the anterior inferior acromion, reproducing pain, as you see on the picture, producing pain in within when the rotator cuff or biceps tendon is compressed, which helps it detect uh, subacromial impingement syndrome and rotator cuff tears. So the Hawkins impingement sign, which is the next one, is also a physical exam, which helps to detect any syndrome or those rotator cuff tears that I mentioned. A positive test will usually be indicated by pain during passive internal rotation of the shoulder when it is flexed and the elbow is bent, causing compression in the shoulder. So another test that you see, one of the special tests, is the internal and external rotation lag test. These are maneuvers used to detect complete rotator cuff tears or full thickness rotator cuff tears. For example, the external rotation lag sign will test if a patient can hold their arm in a maximum external rotation. The internal rotation lag sign, which is part of it, also will test if a patient can maintain their hand behind their back when lifted away. As well as another specific test that we have the drop arm test, also known as Codman's sign, is also a technique used to identify complete tears of the rotator cuff, and specifically for the spinatus tendon. So you have the patient lays their arm to 90 to 120 degrees, and then you ask them to lower the arm to their side. A positive test will indicate the inability to control the movement, resulting in the arm dropping or causing significant pain. That's why it's called the drop arm test. There are some other tests not necessary for the shoulder, but we did not delve into them today. For the knee also has so many tests like Lachman's maneuver, which is highly sensitive for physical examination to diagnose ACL tears, anterior cruciate ligament tears. We did not cover them this time. But for example, this test, you have the patient spine and then the knee flexed at you as the examiner, and then you stabilize the femur and pull the tibia forward. So increased forward or a soft end point indicates a positive ACL. I encourage you to also look at more special tests or special maneuvers, which we could not cover in this 10-15 minutes presentation. Other diagnostic tests, which are highly specific to evaluate muscle groups or tendons. For example, the external rotation resistance test, also known as inflaspinatus test, evaluates, for example, the strength and integrity of a rotator cuff muscles. A positive test usually indicates a potential tear or pathology marked by weakness or pain when the patient attempts to rotate their arm toward outward against the resistance. Another one is the empty can test, which also helps to assess for shoulder injuries. So you are testing for spinatus muscle and tendon for tears. Also assessing for impeachment. So what do? You hold the arm at 90 degrees of abduction in the scapular plane with full internal rotation. And then your arm is pointing down while resisting pressure. Both tests are pivotal in diagnosing rotator cuff tears or tendinopathy. You may have noticed that most of the special tests we discussed in this presentation are about shoulder, but also the knee, like I mentioned, has a lot of special tests that you can use, which provide critical diagnostic information during your physical assessment. Additional techniques you may use, which may depend on the patient presentation. So, for example, measuring the leg length can also help diagnose pelvic tilts or structural discrepancies while properly describing limited range of motion, which ensures clear communication and documentation of the patient's functional limitations. And this is very important for all the adults. So then by putting all of this together, it's not always about, assessing physical abnormalities. It's also about preventing them. We can advise patients on proper physical functioning, ergonomics to prevent low back pain, for example, teach them about calcium intake or weight bearing exercises for osteoporosis prevention. Also, vitamin D is also very important too. And fall prevention strategies, that's very important for all the adults. And also for comprehensive holistic patient care. And another example that you have on your slides is about Tai Chi, teaching them about Tai Chi, especially the older adults for balance. All right, so this is probably the last slide that I have today. And if you have any questions, just let me know. And I recommend that you review more special tests or techniques in your textbook, which we're not able to cover during this short presentation. It's just about the overview of most important concepts that you need to remember, but it's not comprehensive of everything. Thank you.